Coffee with Coker is a healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
Hello, and thank you for joining today. This is Brant Jewell, Senior Vice President at Coker Group, and I'm joined by Kelly Raffel and Andrew Sobczak, both Senior Managers here at Coker Group. And we're excited to be continuing our podcast series related to physician enterprise performance improvement. And today will be our first content session after our introductory session focused on revenue cycle management, which is a focal point in this day and age of financial efficiency and has become in the spotlight for many of our clients as they look for ways to better manage margins and make sure that we're collecting every dollar to which we're entitled. So we're going to break down various areas that we look at when evaluating revenue cycles, some examples of how we've both evaluated and then helped clients achieve success around their revenue cycle improvement, talk about some of the key pitfalls and areas that we see clients struggling with, and some things that we think will be important for you and your organization, regardless of that type and size, to think through and consider as you optimize your revenue cycle processes and performance. So I'll get us started here, and then I'll shift it to Kelly and Andy to talk more in depth about some of these areas. But one of the first things that I want to clarify when we refer to revenue cycle management is that we consider that to be the entire wheel of revenue cycle management, not just the billing office. And so we often hear from folks that they want to, quote, outsource their revenue cycle. And really that's a misnomer in our minds, because you often see groups outsource the billing office or outsource specific functions within the billing office. You may even outsource the front end, but rarely is a practice enterprise outsourcing every step of the process along the revenue cycle wheel. And so if we think about that from front end patient intake to time of service and clinical care, all the way through claims processing, payment posting, and then collection efforts and AR follow-up and denial management, there are usually multiple different groups, individuals, and or areas of the organization focused on managing each of those factors. And we will often find issues in one of those areas that directly impact all of the others. And if the focus is only on the back end billing department as your, quote, revenue cycle, then you'll miss things that you could be focused on before it becomes a problem on the back end. And too frequently we see that billing departments are just cleanup houses where they're just dealing with messes and trying to sort through the myriad of errors that have taken place on that claims journey from the time we first entered the patient name to schedule them at a site of care. So as we think about some of the things that go wrong, we first want to focus on some of the things that we consider to be critical success factors and helping revenue cycle perform optimally. And so, Kelly, why don't you take us through some of the things that you think are critical to managing revenue cycle, and especially on that front end, and getting the claim started in a correct fashion.
Certainly. So, Brant, as you mentioned, really the revenue cycle process begins the moment the patient is scheduled for their visit. And that drives the entire process. So it's really important to get that right up front. So that means ensuring that the demographic and insurance information that's entered at the time of registration is accurate and also comprehensive. Eligibility checks need to be performed consistently as well to ensure that the patient is still covered by the insurance and their coverage hasn't lapsed, for example. And any pre-authorizations that are required by the patient's insurance need to be obtained before the patient receives the service, so that otherwise it'll end up in a denial. So that actually leads to another critical success factor, which is keeping abreast of all those coverage policies and pre-authorization requirements across all of the practice's payers. And each payer does have their own set of policies and pre-certification requirements. So we actually recommend assigning responsibility to a specific individual that regularly monitors the payer policies and requirements. And that can be done either by going to the individual payer websites or just keeping abreast of any payer communications that are received. And then it's important to take this information and consolidate it for the team, so into some type of a resource that is easily referenceable So that might be like a payer matrix where you document all of those different requirements and policies by payer, and then ensuring not only that you update that on a regular basis, but that you actually communicate to the staff that's performing the eligibility, benefit coverage, and prior authorization functions. So once some of that upfront work is done, it's also important once you get to the time of service to be sure that there's proper documentation and coding practices, because if not, that'll lead to denials as well. So there's actually a mantra that we use, which is if it wasn't documented, it wasn't done. So the key to documenting is to make sure that it's supporting the medical necessity associated with whatever service that patient is receiving, again, to prevent denials at the back end. And this also speaks to the importance of coordination and communication between the front office, the billing, and the clinical support areas to support what we call the 3 C's of revenue cycle, which is making sure that there's clean, current, and correct claims. And it really takes a team effort to accomplish that. And finally, ongoing team development and education is important as well. So those are some of the key factors that we see as critical to the revenue cycle management process.
Thanks, Kelly. And I think we can't stress that enough, the interaction between each functional area. And when it comes to documentation, I think clinical teams often get left out of this revenue cycle process. And if you're dropping the ball with your providers on consistent documentation, utilization of templates, and making sure they are educated and trained and up to speed on the services they're offering, and then whether they themselves are assigning codes or you have coders assigning codes or reviewing codes, and we see a mix of all of these things in between, it's important to get this piece right because it eliminates a lot of the feedback that's then required if it's not done right between the billing office and the clinical teams. And if you're in an environment where any of those processes are centralized, for example, centralized coding review or centralized billing offices supporting practices all over a region, then it makes it even more challenging for a confusion or denial around a code or documentation reason to get solved. And you're putting a lot of pressure then on billing departments to get in touch with clinical personnel. And this can be a big issue. The same can be said for the front office, right? If we've got misspelled names or wrong insurances, then we're starting off behind, and then again that billing department turns into the cleanup shop rather than truly solving the issues that need to be addressed with payers. And then the volume could be overwhelming. You don't have enough people to manage all the work to be done there. So now that we went through some of the areas that we think are kind of critical to just fundamental success, one of the ways that you set up these fundamentals is with your policies and procedures, and we'll talk more about that a little bit later. But we like to start with that, and it's an objective best practice policy and procedure process that can then be customized for your unique operations. But many organizations we work with either do not have policies and procedures, or they only have a few and partial complete, or they have some or they have enough, but they don't use them, or they don't know what they are. They've been sitting on the shelf collecting dust. And so that is a great place to start a process internally. Whether you have a lot to work with or not a lot to work with, it can be a great first step towards establishing these critical factors and making sure that there's clarity about them. And so as we go to organizations and evaluate these different areas and try to wrap our arms around what's being done well, what's not, and where there may be opportunities for improvement, we have a pretty standard process that leads us to some very unique findings and recommendations. So we start very similarly with everyone in, say, a revenue cycle assessment environment, but then where that takes us is often different. So next, I'll have Andy walk through kind of how we go about diagnosing the issues and what we look at and how we evaluate. And then we'll also eventually share some examples of case studies with real client examples that we've worked with and how that materialized. So, Andy?
Yeah, we'll talk here about diagnosing the problem. Before I get into our approach and how we would evaluate performance of the revenue cycle, I want to talk a little bit about why we think we're seeing more and more of these issues pop up with clients. And I think a lot of it has to do with healthcare in general transitioning to more of a consumer-driven market. As it relates to medical bills and healthcare reimbursement, a larger portion of the revenue that health systems, hospitals, and practices receive is coming from patients. And as we all know, there's a lot more high deductible health plans out there. Patients are having to take on much more of the burden of healthcare costs. And so, it's a lot more difficult to collect from patients. TransUnion several years ago did a study looking back from 2012 to 2017. They found that revenue for hospitals that was attributed to patient responsibility after insurance paid, that increased 88% during that 5-year period. Just last year, you had a Kaiser Foundation study look at healthcare debt. They cited an analysis of the Consumer Financial Protection Bureau that said about $88 billion in medical debt is currently reflected in people's credit reports. That's not even all of it, because sometimes all of that medical debt isn't reflected in an actual credit report. And so patients are feeling that burden. It's much more difficult to collect from patients than it is from insurance companies overall. There was a study several years ago from the Association of Credit and Collection Professionals that found it was almost 4 times more difficult, 4 times more expensive for a hospital or a practice to collect from a patient than from an insurance company. So that's a bigger burden on our clients for revenue cycle performance. At the same time, we're seeing that insurance claim denials are up from where they used to be. Several years ago, we would think that a denial rate of 5 to 6% is leading practice, is average, for a high-performing organization. That number is growing. We're seeing average denial rates across the industry at around 12, 13, 14%, making it much more difficult for revenue cycle professionals to follow up on claims, to actually get paid what they're owed the first time. And so you combine that consumer-driven market, more difficult to collect from patients. We all know that the economic pressures of today are more challenging than they were even several years ago before the pandemic. So patients are less likely to pay. And then insurance companies are making it more difficult to get a claim through and approved for payment on the first time. And so we think that those factors are kind of coming together to create an environment where revenue cycle management is more important now potentially than it ever has been. And so we get a lot of inquiries from clients that are having these issues. And so when we receive those, we take it very seriously and try to put a very thoughtful process in place to diagnose the problem, because as Brant mentioned, it's not just the billing office that we're talking about. It's the entire, wheel, revenue cycle of, check-in or registration from the time you get the patient's information all the way through to when the claim goes out. You're collecting on the back end, both from insurance and patient. There's a lot of steps in between there. And so we try to look at, quantitative indicators, obviously, where you have, like a net collection rate, you have clean claim rate, what percentage of your claims are going through to the payer at the first pass, as opposed to getting rejected in your system, what your cost to collect, what your AR look like, different AR aging buckets. Where is all of your AR sitting? Is it older or is it, more current? What is your denial percentage? What are the common reasons that you're receiving denials? And so we go through a number of key performance indicators to get an idea of where performance may be lacking, if there's one area or another. But then at the same time, we really try to focus on observations and interviews with frontline staff, but also management team to understand from all perspectives what's going on in the revenue cycle. Do the staff understand what their role is? Because each particular individual has a very important and specific role to play in getting that claim form populated and then sent out to the payers. And they need to be doing their job in a very specific manner so that gets out correctly and on time. And so are those policies in place? Do the staff even know that there are policies? What do the staff think the problems are? A lot of times we get a lot of great insight just from sitting kind of, shoulder to shoulder with the team and understanding where their issues may be. They may very well understand what their role is, but maybe there's a system issue. Maybe they have a difficult time navigating a work queue or finding a report that they need to have. And so is that information being fed to them from leadership, or are they having an issue with their system itself? There are a plethora of technological, advances in revenue cycle that people can choose from. You have a lot of different reporting suites, dashboards, systems that will automate your revenue cycle, quote unquote. A lot of times those get implemented, and the staff that actually do the work may not understand what's going on. They may not have mapped things correctly. You could have a report that has denial reasons completely jumbled from what you actually get from payers. And so you don't know what your main reasons are because the data isn't giving you an accurate representation. And so we see all of those things and we learn all of those things when we actually observe staff, interview staff and managers, as opposed to just looking at the key performance indicators. Those are very important, but a lot of times the real story and the real root cause of the issues are found when you speak to the front lines and kind of share those insights with leadership to understand, oh, maybe this is why that denial rate looks so low. Maybe this is why we're, not getting claims through. It's a 60% clean claim rate. And so we try to combine that quantitative and qualitative piece in our review of their revenue cycle performance. And we find that typically at the end of that process, we have a pretty good idea of where improvement could come. We don't always have, exactly what's going to come next in terms of like who's going to do what, but we have a really good starting point for where the improvement efforts should prioritize certain items. Along the way, we see a lot of common issues or pitfalls, and I think we wanted to get into that a little further. So I think Kelly's going to pick it up here and talk about, those areas in some more detail.
Yeah, thanks, Andy. So first of all, one of the common areas of deficiency that we see is a lack of formal written policies or procedures. And Brant talked about this a little bit. Or maybe there are policies and procedures, but as he said, they're sitting on a shelf and the staff is not utilizing them, or there's not workflows that have been built around that. So we think it's important to look at the policies and procedures and create a playbook for achieving consistent results, more or less. Another pitfall can be when the revenue cycle management structure is not organized according to key revenue cycle management functions. And what we mean by that is sometimes, and it can be organized in many different ways, but some clients organize it according to location, for example. So billers are responsible for all the activities related to a certain location, but sometimes they may be better served organizing it around the type of function so that maybe it's payer specific. So you have one individual that's responsible for Medicare billing, another one that's responsible for some of the top commercial payers. That helps to build some specialization. So that could be another area of deficiency. Another area that we see that can be a barrier is, and Andy talked a little bit about this, is subpar analytics and reporting. This can make it really challenging to evaluate the revenue cycle management performance. And there can be a number of different causes of this. So sometimes we see practices, for example, that rely on reporting that really takes a lot of manual effort to produce, or also practices that may not be using the reporting tools available within the practice management system to the full capabilities. We also see some more sophisticated practices at times that still struggle with reporting and analytics. And this could be because they're relying on multiple systems that are not integrated, and then they may struggle to determine which one should be considered the source of truth. So we recommend when there's certain measures that can be found in multiple systems, that it's important for the team to establish universal agreement on which system should be considered the source of truth for that metric. And there also needs to be confidence in the integrity of the data. It needs to be complete and accurate, and it needs to be able to be relied upon for use in decision making. And if there is not that level of confidence, then there needs to be action taken to try to remedy that.
Thanks, Kelly. And as we transition from thinking about diagnosing and identifying issues and establishing common pitfalls here, we're going to talk about solutions and what we recommend and what examples of how we've worked with organizations in the past. And one of our key mantras with really all areas of performance improvement is data-driven accountability. And this is not just having dashboards or having metrics or having key performance indicators. It's how you use them and how you integrate them beyond just the leadership team or the ownership team and into the front lines of your operation. And so as Kelly was just talking about, establishing a source of truth, having consistent metrics, and some of the areas that we see the ball getting dropped on a regular basis, we like to put the data as much as possible. We'd rather have fewer metrics and put it in the hands of people who are managing claims and touching claims on a daily basis than have an extensive executive level report that in hindsight could tell you whether you did good or bad. It's nice to have both, but what I mean by this is integrating specific key performance indicators into the job competencies of staff who work in the front office, on the clinical team, or in the billing department. And it doesn't have to be a dozen of them. It could be 2 or 3 metrics that tie together their involvement and the role they play in all areas of operations, but particularly in a revenue cycle. And so just thinking about something as a clean claim percentage or a denial rate, right? We've already talked about how denial rates can be generated, or denial issues can be generated from any step along the process. And so it is a team effort, organization-wide effort to reduce that denial rate. And it's not just up to the billing office to fix it and lower the denial rate. So as we think about solutions and how we implement change and manage change over time, reporting is important, but focus on the functionality and the actionable information as opposed to just data overload. And the more our clients have systems on top of systems on top of systems, there starts to be confusion about the source of truth, and then also issues with too much data and not enough information and not enough takeaway. And so we like to try to simplify it. And the beauty of that is it doesn't matter what systems you're on. If you think about simple and the outcomes you're after and implement around that, track those metrics, then you can manage improvement in any environment. You don't have to have the fanciest, latest and greatest reporting or EHR or whatever it may require. So as we go into this next section, I'm going to have both Andy and Kelly give an example of some recent revenue cycle assessments that we conducted, and then how those manifested into us supporting implementation and improvements in different ways. And as we already alluded to, our process is very similar in terms of diagnosing in all the areas that we first focus on to get our arms around the issues and get a kind of an understanding of the landscape. But then where that leads us and how we end up managing change is pretty unique from client to client. There's not a one size fits all, to Kelly's point. In one case, we may recommend structuring your billing department around payers or around locations or around providers. And in another case, we might recommend structuring it around specialty or just around geography, right? And so I think understanding each organization's strengths and weaknesses and infrastructure is part of this, and you can't assume that what's good for one is good for the next. So Andy, why don't we start with you, and you can tell us about a case study that we did for a regional hospital system in the Southeast.
Yeah, this particular case study the improvement effort is around time of service collections or patient collections. Like I alluded to previously, how the industry here is becoming much more consumer driven. Patients are bearing much more responsibility for their medical bills. And so this particular, client really saw that kind of come to light. And when we did our assessment of the revenue cycle performance, we found a huge deficiency in time of service collections. This particular client had a group of about 35 practices, and they had a software solution that was designed as kind of like an add-on to their practice management system, where it was a system that had iPads at check-in. Patients could, sign in, they had credit card swipes on the, easy payment options. It had reporting on the back end for, copay collections, patient balance collections, everything you might expect to see on paper in a particular, collection solution. However, their performance was, they were collecting about 40% of the balances that were owed to them from these patients. On the copay side, they were closer to 90%, not terrible, but we'd like to see them at about 95%. And so most of our effort was focused on getting that patient balance collections percentage from 40% closer to what we would see as leading practice, which would be about 80% or so, 80, 85%. And so we set some short-term targets for them. But really where we started with this, and Kelly alluded to this in her section about the importance of data and a source of truth, we started with the reports to see, okay, what's behind this? What do the leaders and the managers think? And the answer was they didn't believe it. They didn't think any of it was correct. staff didn't necessarily even know what the reports were because a lot of the values in the reports were inaccurate according to the managers. Some of those reasons were that they didn't map all of the visit types accordingly. And so patients that were checking in were showing copay amounts due that were incorrect. When you looked at their insurance card, it didn't always match what was in that particular system. Sometimes the patients that would show up and have a balance, that total would be incorrect. And so we had to do a lot of work with the client, but also the vendor to provide some feedback and root cause analysis on why these reports were not being populated correctly. And the key takeaway there was involving the people that do the work, not just the managers, but certain staff that understood the reports and could point us to where some of the mapping was off from where they implemented. And so once we kind of got that group together and provided a round of data validation, we changed the way some of the mapping worked to where the report was more and more accurate. Then we got together a group of key managers to do kind of a pilot run where we created this dashboard that showed performance of all the practices, high performers all the way down to the low performers. Everybody could see everybody's performance as it relates to patient balances and copay collections. That particular pilot group was then sharing the report with their staff. They had information behind the dashboard for how to look at staff individual performance, look at collections by certain visit types, all of those things. They could work with the team to understand at a root cause what's going on at their own location. And what we found after a few months of that group coming together, it's about 11 pilot locations out of 35, they began to create and develop their own best practices between each other, whether it be implementing what we called free service collection calls, where they would have an appointment reminder. The staff were already calling the patient manually. It wasn't an automated reminder, but introducing a conversation with the patient at that point. Hey, you're coming in today. Please know that our policy is payment is due at the time of service, and also you have an outstanding balance of X dollars. And they would either work out a payment plan, or the patient would, come up with a plan to pay at the time of service. And so things like that were instituted across those 11 locations. Eventually, we were able to get this dashboard out to all 35 locations. And after about 6 to 8 months or so of the engagement, where it started with the data, validating the reports, dashboards, getting the teams together, piloting, and then all the way through, we were able to help them improve that collections performance from 40% up to 65% for the 35 practices, which would have led them to, or was leading them to, about a $700,000 annual time of service collections improvement. And for them, they were smaller practices, so it's not, like it was a huge system, huge practices, but that was a very meaningful amount of money for them on the revenue side. And it was very staff driven. And so this was a particular case of time of service collections, patient responsibility. It's more difficult to collect, and a lot of our clients are having trouble there. But for them, it was a matter of using the software that they already purchased and already had, really high expectations for, to provide correct information, but then also being transparent with that information, sharing it with the people doing the work, the managers that are on the ground with their staff, and allowing them to, learn from each other and, set their own goals. At the end of this, the organization itself, which was kind of this would be a sustainability measure, they started to integrate these goals into the staff, the kind of check-in, front desk staff, managers, performance evaluations. And so they had incentive goals for the year on their annual performance review of, did my practice hit our collections goal? Did did the rest of my front office colleagues and I hit our collections goal? And there were, incentive dollars at the end of the year tied to that for the staff. And so we find that, those types of efforts and those types of ongoing processes for organizations can really sustain these improvements and not just make it a one-time thing. The last thing we want to do is have a big push for, the consultants are here, let's just get through it. We'll, do our job with this project and then we're done. It's really, how do we keep this going? Because it's an ongoing issue for them, and it can't just be solved with a one-time effort. And so we felt really good that they were able to sustain this improvement for about 4 months until we, kind of stepped back and we're able to transition to them. And so that particular effort kind of emphasizes several of those themes we've already talked about: the patient responsibility, the growth of that, the importance of that in the revenue cycle industry, but then also this idea of a technology solution not just being a plug and play, where there's so many different things and solutions to choose from. I think people get a misconception that they can just purchase something, bolt it onto their system, and all their problems are solved. In this particular case, that really played out, where they needed to do the work of involving the right people, making sure everything's validated, the information that they're being, that they're receiving is not just understood at the executive level, because those are the people that are going to implement and pay, the vendor for the solution, but you need people that are actually going to take it and run with it to understand the information. So we feel really, good about this achievement. We're able to get all those folks on board and create something that we believe is more sustainable for them.
Thanks, Andy. We'll just go straight into you, Kelly. You want to go ahead and talk about the other example we had out in the Southwest?
Certainly. So we work with a client that engaged us, first of all, as you mentioned, Brant, to perform a full assessment of the revenue cycle management operations. And then they asked us to assist with the implementation of our recommendations for improvement. And one of the main thrusts of that was optimizing the utilization of the practice management system and its reporting capabilities. So one of the areas where they were struggling was with denials management, both in the teams working the denials, but also in tracking the denials and identifying trends to try to prevent them in the first place. So one key takeaway from this engagement is ensuring that your practice is leveraging the capabilities of your practice management system to its fullest potential. So in this case, for this particular client, we found that they were actually not using the denials management module that was available to them at no cost. And so therefore, they were struggling to gain a comprehensive understanding of the denial trends across the organization. So once we worked with a vendor to fully implement that module, it made a world of difference and really helped them to track and trend their denials, to work their denials more effectively, but also to begin to address common denials before they actually occurred. So we recommend, as a takeaway from this, first work with your vendor to make sure you understand all the capabilities of the system available to you. But then if there's a particular area where your team is struggling, tap your vendor representative again to see if there's a better way the system can be used. Or if your vendor has a user group, for example, reach out to your peers to see if they may have some suggestions for best practices in using that system. There's other success factors related to this engagement that I'll just summarize at a high level. So developing policies and procedures was also a key part of this initiative. And, we really tried to ensure that their policies and procedures were based on industry best practices, and then we restructured workflows accordingly. Similar to Andy's engagement, we ensured that they created clear targets and goals, and those were tied to the performance evaluations for their teams, both in the front office, also in the back office. And then another area that we felt was really important was working to facilitate regular communications between the front office and billing teams, because that really didn't exist to the extent that it should at the time when we did the assessment. So this, in this case, involved incorporating some joint meetings on a regular basis, but it may also involve having, for a larger organization, it may involve having liaisons from the billing office that are responsible for reaching out to the front office teams. And also, similar to what Andy mentioned, utilizing dashboard reporting for key performance indicators. And some of these we've talked about before, but could include metrics such as registration accuracy, clean claim rate, denial rate, also the percentage of copayments due that are actually collected at the time of service. And then monitoring progress in relation to those goals, and then working to address any gaps in performance by identifying the root causes and then taking action after some thoughtful planning and strategies.
Thanks, Kelly. Just to summarize and try to pull all this together, I think we've touched on a lot of different areas that we think are important, and that's both intentional and illuminating for how difficult it is to effectively manage revenue cycle. I think a lot of our clients have tried to hit the easy button as it relates to, again, quote, revenue cycle by outsourcing or partnering or finding someone else to do specific functions. And if you asked our team probably 5 years ago, just even going back to pre-COVID, and some of the technology that's come along since then, and then just the ability to manage things virtually, we probably have come around a lot to the idea of outsourcing specific functions more than we used to. We still would prefer to own the revenue internally as much as possible. And so where we think clients have the ability to both hire the expertise and build the infrastructure they need, we would prefer that they do that, and then no one cares more about the revenue than they do. And so that's still our preferred method. But we've also worked with multiple clients where it's just not feasible. They can't find the expertise. They can't find people in their small town who have done this before and can manage the process. And so there are some good alternatives out there as you consider it. And the key is to make sure you manage any vendors you work with around your revenue cycle, whether that's front end, time of service, or coding, and then also certainly on the back end, which is the most common area of outsourcing, to hold them accountable and set up KPIs for their performance, just like you would if those were your teams. And so I know that's a tough thing to manage if you haven't done it before, and we'll often build pro formas and make sure that the ROI is there and that you understand what you should get for what you're paying, and that's both helpful whether you outsource or not. So as you think about these areas and how to prioritize them yourself, I would include those types of decisions in your strategy where you're after an outcome of the most efficient revenue cycle, billing, and collection that you can develop and implement. And so if the best thing for you to do is to mix and match with your own resources and others, then I think that's an appropriate strategy to consider. So whether you're organizing around specific functions or geography or providers, whatever makes sense for you, making sure that you have clarity of targets and goals at the organizational level, but also of the roles and responsibilities and expectations for the individuals that you have working on those processes, that can really drive a sense of collaboration where you're using the data and the targets as a means to facilitate and foster communication between the people doing the work on the front lines. And that is a big cultural change for many organizations that rely upon a practice manager or a billing office director to implement or enact any sort of change or accountability. But if I in the front office know that what I do is relevant to what the clinical team is going to do, and then what the billing office is going to have to fix or not fix on the back end, then we're going to have some communication happening without involving leadership or others and administrators, where we are all incentivized to get this right and address issues in real time in the trenches on a daily basis. And that's a really powerful element of improving your performance that is what we try to implement in all of these engagements. And some organizations, quite frankly, get there and some don't. You can make big steps without it, but that's really what we see as the panacea for improving the performance and getting all the juice you can out of the efforts that you put into this. Last thing I'll say is we often will quantify the opportunities based on your strategic objectives, but certainly also around the financial opportunity. So if you go through, whether you work with a consultant or a third party or do it yourself to evaluate your current state, your performance, and where you find the most opportunities, trying to quantify that and prioritize where you go first is an important step of the process. And it's very collaborative when we do that with clients, because there may be some things that are low-hanging fruit that even if they don't have the most financial opportunity, it's the easiest to implement first. And vice versa, it may be that the financial opportunity jumps off the page to the extent that that should be moved to the top of your queue. And don't be afraid to question the status quo. If you haven't made significant changes to your revenue cycle processes over the last 5 to 10 years, then there are probably some things that you could do better just based on the technologies out there and the systems and vendors that you might be able to leverage. So I would say question status quo and ask yourself, are there ways we could do this better? What are our peers doing? As Kelly said, what is this system? What does everyone else on this EHR do to make this work? It can't be this bad for everyone is not a poor way to enter these types of discussions. And as we like to start, and part of the reason we started this podcast series with revenue cycle management is that revenue cycle is objectively an area that everyone wants to do well with. Whether you're a clinical person, an administrator, or front office person, collecting all the dollars that we're entitled to collect based on the services we provided is generally an objective priority. And so as you consider improving other areas and know that this is also something you want to focus on, we like to start here and use it as a rallying point to incentivize and get everyone on board with the idea that we're going to elevate our play. And as we do it, this is an area that impacts every role in the organization and is something we're going to focus on as a team with very measurable outcomes, and that improves our financial health. And so we started with it here intentionally today, and we're excited about many of the other areas that we're going to address throughout this podcast series. But revenue cycle is certainly a fundamental element of a successful physician enterprise. And so hopefully this has been helpful, and we would be happy as always to answer any questions or provide thoughts and feedback on anything we've discussed today or some of the unique challenges and areas that you're facing out there in the market. And you can get in touch with us through our website or via our email forums. And I want to thank Kelly and Andy for participating today. We'll have them on some of the future sessions as well. And we look forward to continuing this series. Thank you very much and have a great day.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us in a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback, and we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.